I did a self-exam, like they say in the shower one day, and said, oh, here's a lump. And I really didn't take it seriously.
It was in 2003, and I found a lump about here.
I had gone in for my mammogram, and then they found something, so then I went back for a biopsy.
It was a mammogram, and in those days they didn't send you the report that says no cancer. They sent it to the referring physician, who they just kind of forgot to tell me that I should go back in 6 months and get another checkup, another mammogram.
It was obviously a shock, as I'm sure a lot of people would say.
So the biopsy was then sent to my then family practitioner, who called me in, and it was a real jolt. Well, there's no way to avoid it, Judy. You have cancer. Whoa.
I had breast cancer.
I had breast cancer.
It was DCIS, fortunately only stage 2.
And I can remember that moment really well. It was a really frightening experience.
You might as well drop a ton of bricks on top of me.
I really held out hope that it was not cancer.
As we all know, only your hairdresser knows. And it was from my hairdresser. And so when I told her about my newly discovered breast cancer, she said, well, you know about Breast GYN Health Project. So she insisted from that moment I come down here and talk to y'all. This project is really unique in that all the services it offers are free.
I work as what's called a warm liner. I have a group of clients that I call and check in with. They're really great there at radiation oncology, aren't they? Yeah.
And just being able to call and say, I'm really scared, and have somebody say, yeah, okay, let's talk, or do you want to come in?
So that level of attention and people listening to me and giving me back what I needed is very important.
Sometimes that warm liner and staff person is the only consistent thread through a cancer patient's experience. They go from different department to different department, but our warm line volunteer follows them that whole journey.
For me, the most valuable is definitely still the support groups.
For me, it was definitely probably the support groups.
Being able in those support groups to support other people.
Getting to go there and laugh and cry and be angry, and it's all accepted. You know, nobody's judging me for still processing, and we're obviously not always on the same position in the timeline, but we can still, you know, empathize and sympathize with their journey, and they'll still do the same for me.
I was getting ready for my mastectomy, and I really wanted to talk to somebody who had had a mastectomy because I wanted to be prepared. You know, of course the surgeon can talk about what that actual process is going to be, but I wanted to talk to somebody who had had that surgery and woke up after it without their breast, and how best to prepare for that.
It hasn't changed a lot in how many women have breast cancer nationwide since I was diagnosed, so I don't see that changing anytime soon. It just seems like we have to be there.
Breast GYN Health Project, may I help you?
Oh, thank you.
H is in Henry. C.
I'm Rose Gale-Zolik, and I'm the Executive Director at the Breast GYN Health Project. There are other cancer resource centers, but most of them are part of a hospital or health system. There really aren't very many community-based cancer resource centers like the Breast GYN Health Project. Part of what makes our organization really unique is that since we started, we've always had a doctor who's been available to do education and consultations with the staff and the volunteers and with the clients.
I'm Mary Mings. I am a family medicine physician. Our main sort of mission and goal is to support any person going through the experience of a potential or concern for breast or gynecologic cancer, or the diagnosis and then everything that comes after that. So that may involve meeting on phone or in person. If someone meets with me, a lot of times it's to review the medical reports they already have, like their pathology report, and to help them understand that. And, sometimes that includes someone who doesn't want to take any or all of their recommended conventional medical care. And we sort of put aside our own personal feelings about that because we're here to support that person.
My name is Madeline Amir, and I am the Co-Client Services Director at the Breast GYN Health Project. So one of the resources that we have is the breast nest. And inside the breast nest, we have gently used mastectomy bras. We also have gently used wigs, a plethora of hats and scarves and head coverings. And so it's a really lovely resource, and all of our services are free and they're all donated.
We do have a lending library here at the Breast GYN Health Project. It's the biggest lending library kind of north of the Bay Area, and it has topics that are beyond the clinical aspects of cancer. There are cookbooks, lots of cookbooks. There's children's books. There's some books in Spanish, yoga, spirituality. It's a wonderful lending library.
We have a great tool called a medical records binder. The other piece that's really important in here is a calendar, because you're going to get all this information thrown at you really quickly, and you're going to get an awful lot of medical appointments thrown at you, and you have to make sure that you're not double booking, and you have to make sure that you're getting everything organized. The Breast GYN Health Project is celebrating 25 years, and it's still going strong, and it's still doing its original mission, which is to help people negotiate and get through this diagnosis.
For me, and I think so many people I talk to, it's the support people give you, how valuable that is to pass that on.